We discussed that endometriosis can present with symptoms such as painful periods, painful sex, and pelvic pain, and this can be treated with hormonal pills or pain relief tablets. However, this is just in case of simple endometriosis, which is mild. In advanced cases where the symptoms are much more severe, you may need further investigations and surgery. In women with severe endometriosis, which we classify probably as stage 3 and 4 endometriosis, they may have pelvic pain which is lasting much longer than their periods itself, maybe sometimes throughout the month. If the bowel is involved, they may present with symptoms of painful motions and blood in the stools, especially around the time of periods. If the bladder is involved with endometriosis, they may have need or urge to pass urine more frequently, painful micturition, or blood in the urine, and this is again exaggerated during the time of the periods. In these cases, we investigate further with the help of ultrasound and with or without an MRI additionally. This helps us to define the extent of endometriosis and the type of surgery you will need. The surgery we usually do is a keyhole surgery. Some of you may be recommended to take hormonal injections before the surgery in order to reduce the extent of endometriosis and the scarring. During the surgery itself, the gynecologist themselves may be able to release all the scarring from the endometriosis and remove it, or they may seek help from bowel surgeons and urologists if necessary, if the ureters or bladder and bowel are involved. Following the surgery, you will be recommended to take hormonal tablets or injections to reduce the risk of endometriosis coming back, unless you are planning a pregnancy. As I said, the endometriosis unfortunately comes back despite a surgical management or pills, as long as we have the ovaries and are producing estrogen. And the foolproof way of treating endometriosis is removal of ovaries, which can be done in women over 45 years of age, but in younger women that's not possible, and it needs a lot of discussions with regards to how to manage your pain and keep the risk of endometriosis coming back as low as possible. This will be usually done in a clinic, and it's quite detailed. If you need any answers, you can contact me on my email or WhatsApp. I will send you more information. And with regards to the surgery, I will be discussing the surgery for endometriosis in my next video. Thank you.